The CDC is out with a new warning about COVID. Yes, COVID. It says the number of cases is now growing or likely growing in at least 27 states. Yike. And COVID-related emergency room visits for young kids, they're the highest they've been since March. We're joined now by CBS News chief medical correspondent, Dr. Jon LaPook. I heard you coughing over there. You okay?
You noticed, though, I went like this.
I did
well
notice
done.
you that. But we are so sick of hearing about COVID. How concerned should we be? I think it triggers PTSD for a lot of people.
I think you're exactly right. My patients certainly come in like this. You know, every season, we now know that there's a winter spike and then there's a summer spike, right? And every year, I just looked last night, the number of deaths, the number of hospitalizations is gradually going down each season. So that's the good news. But people should not be blasé about it, okay? COVID, you know, if it strikes you, especially for the vulnerable, and we're talking about very young, you know, children under the age of 4, the elderly, people who are immunocompromised. You know, there are millions of people who are immunocompromised out there. They can really get sick. I've had patients who are immunocompromised who get really sick from it.
So what do you attribute this spike to?
I think it's just, you know, there's a winter, it's complicated about why that is, but we see this with a lot of illnesses. There's a winter spike, there's a summer spike, and it's complicated about why it goes up and why it goes down. But, you know, one of the things that people are having to grapple with right now is, should they be getting vaccinated?
Yeah.
And we're in a kind of an odd period right now because the CDC has a little bit of a different recommendation for vaccination than the major societies, you know, like the American College of Obstetricians and Gynecologists, who say that pregnant women should get vaccinated because the baby, when the baby is born from like 0 to 6, before they can get a shot, they're really relying on the mother's immunity, right? The mother has the antibodies, it goes through the placenta, and then the baby has some protection. And so they're saying, look, you should get vaccinated. The CDC...
But they took the vaccination schedule off for kids
what they said,
a couple months ago.
Yeah, what they said was Secretary Kennedy said, it's now shared decision-making. So that means that go talk to your clinician about it, which is always a good idea. But it's a little bit of a different recommendation than just saying, go get it. And they're saying also the same thing for healthy kids.
What are you hearing about these variants, Nimbus and Stratus?
You know, I heard those are two names of different types of clouds, right? It's like the Nimbus 2000. I think it's like, is this like a Harry Potter thing? That was his first broomstick, wasn't it?
Yeah.
But these are different variants. The good news about the variants, I just again checked last night, is they still are susceptible. They're no more deadly than, say, the last variant. We're seeing these variants all the time.
Okay.
The vaccines that were made for the last season, for this season, do cover the current variants. So that's good
news.
But just, I think the bottom line here is, don't be blasé. It's the summer. People have all sorts of things. Be careful.
Yeah. Dr. LaPook, thank you very much. Really appreciate it.